Madeleine Leininger was a nationally known educator, author, theorist, administrator, researcher, consultant, and public speaker. In this slide presentation, we are going to discuss her education, her achievements, and tell you a little bit about her transcultural theory. Madeleine Leininger was born on July 13, 1925, in Sutton, Nebraska, on a farm with four brothers and sisters. Her aunt, who suffered from congenital heart disease, was the one who encouraged Madeleine to enter the field of nursing. In 1942, Madeleine graduated from Sutton High School. In 1945, Madeleine and her sister entered the Cadet Nurse Corps and a diploma program at St. Anthony's School of Nursing in Denver, Colorado. There, she earned her diploma in 1948. She then received a Bachelor of Science degree in Biological Science and a minor in Philosophy and Humanistic Study from the Benedictine College in Athens, Kansas. In 1954, she attended the Catholic University of America in Washington, D.C., where she received a Master of Science in Nursing with a minor in Psychiatric Mental Health Nursing and Psychology. In 1950, Madeleine opened a psychiatric nursing service and educational program at the Creighton University in Omaha. While serving as associate professor at the University of Cincinnati, she began the very first graduate program in psychiatric nursing and the first clinical specialist program in child psychiatric nursing in the country. Madeleine then moved to the University of Utah College of Nursing, where she served as Dean, Professor of Nursing, and Adjunct Professor of Anthropology from 1974 to 1980. But it doesn't stop there. In 1981, she began her tenure at Wayne State University as Professor of Nursing and Director of the Center for Health Research and as Adjunct Professor of Anthropology. Finally, Dr. Leininger retired on June 1, 1995. Dr. Leininger was appointed Professor of Nursing and Anthropology at the University of Colorado in 1966. While she attended Wayne State, Dr. Leininger won numerous awards, including the prestigious President's Award for Excellence in Teaching, the Board of Governors Distinguished Faculty Award, and the Gersonson's Research Fellowship Award. In 1990, she was presented with the Woman in Science Award from California State University, in addition to many other awards and honors she received throughout her career. And as of 1995, she had written 25 books, published over 200 books and articles, and developed a software program. She had also given over 850 public lectures around the world.
Madeleine Leininger's theory was known as the transcultural theory, also known as the culture care theory, and it was first developed in the 1950s, but it did not appear until 1991 when she published Leininger's Culture Care Diversity and Universality. The theory then was further developed in 1995 in her book Transcultural Nursing, and then in 2002, Transcultural Nursing was published, which explained the theory-based research and application of the theory. And then to get into the transcultural theory, it has actually now been developed into a discipline in nursing. The transcultural nursing is the study of cultures in order to understand similarities and differences upon different cultural groups, which culture is then defined to be a set of beliefs held by certain groups of people that is handed down each generation. And within transcultural nursing, nurses do cultural assessments, which we will talk about later in this presentation, but this helps then develop the best care plan fit to their patient, and it helps the nurse figure out the patient's needs. This theory is beneficial because it helps nurses determine the best way to take care of their patient and teaches the nurse to respect the diversity in patients throughout their job. Certain cultures may require certain needs or have different cares than other cultures might have, so it really just helps the nurses follow along with what that specific patient needs. And then also throughout the transcultural theory, Leininger said that the nurse needs to evaluate how they would take care of the patient if their own beliefs would get in the way of them taking care of the patient, because then they wouldn't be giving their full effort or full needs of care to the patient without having a bias. Sunrise model is Leininger's visual way of expressing her theory. This model describes the relationship between anthropological and nursing beliefs and principles, and it connects the concepts of the theory with the actual clinical practices.
Here we present an example of how transcultural nursing is used in the cultural assessment of a Hispanic patient by using information we know about the Hispanic cultural values. Transcultural nursing deals with context. Understanding the Hispanic culture. In the Hispanic culture, food abundance is a sign of wealth. When invited to a Hispanic home, you will be invited to eat, and normally they do not take no for an answer. Not accepting the invitation is actually viewed as a sign of disrespect. Being overweight is not viewed as a health issue, but rather it is viewed as a sign of good health instead. Herbal and home remedies are a big part of the Hispanic culture and are usually resorted to before seeking medical attention. Religion is also a big component of their culture. Illness is perceived only if there is a presence of pain, therefore ignoring the idea of possible underlying health problems. Males are expected to be tough, strong, and never complain of any pain.
Here we will show you how transcultural nursing is put forth into daily nursing practice. Respect for traditional cultural values is the first component to providing the best care. If there is respect for the patient's culture, it shows the patient that their values and beliefs are being accepted and taken into consideration. In the example of the Hispanic culture, having the knowledge and understanding and the background and beliefs of the patient is a key component to be able to bring forth appropriate and effective care. The nurse is able to address high-risk health problems and risk factors such as hypertension or diabetes in relation to diet prior to the patient experiencing any noticeable health issues or hopefully being able to avoid them altogether. Knowing the culture allows the nurse to ask about and rule out any home remedies the patient may be taking that can cause a drug-to-drug interaction with the patient's prescribed medications. Being able to provide the patient with an attainable plan of care will provide for a successful outcome. An example of this would be to suggest for the patient to take their medication in combination with the belief in prayer for the best health outcome. This will give the patient more certainty and willingness, but most importantly, openness to new approaches to health issues.
The goal of the theory is to provide culturally congruent care. This is because if it is meaningful to the patient, then they will adopt it. We will use Jehovah's Witnesses as an example. Jehovah's Witnesses refuse blood transfusions due to the fear of their religious convictions. These Christians believe Jehovah made each and every one's own body special and specific to each individual person. They believe the Bible's answer is that the Bible commands that we do not ingest blood. Therefore, we should not accept whole blood or any of its primary components in any form, whether offered as food or as a transfusion. Finding a way to accommodate their cultural needs means to focus upon the comparative study and analysis of a certain culture with respect to nursing and health illness caring practices. These are just some examples of how Madeleine determined that care is an enabling process. When encountering a different culture, it is important to respect their cultural values and beliefs. Madeleine believed that listening, observing, and cueing in on a patient's cultural values was critical to transcultural nursing.
The three modalities of Madeleine's transcultural theory. Culture care preservation or maintenance is used in the assessment process in which a patient's cultural needs are addressed. Examples of this would be knowing a specific diet restriction or language barrier for the patient. Culture care accommodation is expressed when a patient's cultural remedies, rituals, or beliefs are accepted for a beneficial outcome. Cultural care repatterning is used when a nurse helps a patient change or modify a custom for a more beneficial one.
Discrepancies in cross-cultural care. Some potential problems are varying education, environments, and experiences among healthcare professionals. Two discrepancies have been illustrated by Leininger, where providers lack full understanding of patient needs and find the experiences strange when needed to both comprehend and accommodate variances in the care requested. The first discrepancy example by Leininger is a Mexican-American woman who was late to her appointment. She explained her situation to the staff of having a lack of transportation, childcare, and directions. However, they didn't understand her hardship and didn't accommodate for her either. So instead, she sought out a local healer instead of mainstream healthcare. The second example is a Chinese man who was told to drink cold water without being offered any alternatives. He refused it and was told he would require IV fluids if he didn't drink the water. The patient's daughter had to explain that he prefers to drink hot tea. A transcultural provider would have attempted to communicate with the patient and accommodate for his preferences, instead of threatening him or becoming frustrated with the situation. These two scenarios demonstrate the idea that all nurses have the ability to withhold preconceived notions of patients characterized by ignorance of cultural needs, which is as damaging as providing deliberately poor care. By having an open mind to diverse needs of patients, nurses can achieve higher patient satisfaction and appropriate treatment per individual. Nursing heavily relies on caring for the patient and sensitivity through transcultural nursing.
And this is just a meme I made. It correlates pretty well with our clinical experience because I know I've personally forgot culture questions, and it may seem like something so small, but it's actually super important in the nursing world just to make sure you can give your patients the right care that they need.